Hello, everyone. Thank you for joining us today on Perspectives. Sadly, we report gun violence news stories all too often. Shootings and mass shootings and school shootings. Gun violence and the fear of gun violence has plagued the community now. We're adding to fear and anxiety. According to the CDC, firearms kill an average of 132 people in the United States every day. There have been more than 400 mass shootings this year alone. A mass shooting is defined as one in which 4 victims or more are either killed or wounded, not including the shooter. Mobile has now launched the area's first hospital-based violence intervention program. It's modeled after other successful programs nationally, and its aim is to prevent violent crime in the city of Mobile. Now, through a partnership with the USA Health University Hospital and the Mobile County Health Department, this new initiative will help combat cycles of violent crime as well as retaliation by engaging crime victims as they are being treated in the hospital. It will also connect victims and their families to long-term services and support. Our guest today on Perspectives, Dr. Ashley Williams-Hogue from USA Health University Hospital. She is a trauma, acute care, and burn surgeon, also director of the USA Health Center for Healthy Communities and founder of the Project Inspire. Representative Adeline C. Clark, she is with the Alabama House of Representatives. Representative Clark represents District 97. And the Deputy Director of Public Safety for the City of Mobile, Curtis Graves. After a quick break this morning, we'll hear from our guests on how this partnership and new initiative, a hospital-based program, will help keep victims of violent crime from becoming re-victimized or to perpetuate a cycle of violence. They say they want to build stronger support systems for Mobile, directly impacted by violent crime. Perspectives continues in just a moment. Welcome back. Today we're talking about community violence and how do you end it? How do you stop it? Well, these three have come together as part of a larger team too, where partners from the different communities, the medical community, the political community, government, as well as city government have come together to put together an intervention program. And this one's interesting because it's called a hospital-based intervention program to address this violence issue. And we thank all three of you for being here today. Now, how did this come about? Because when you talk about bringing in the health department, the major medical facility of the area at University Health, USA Health University Hospital, it's a lot. And then, of course, you had help with some of the legislative issues by having Representative Clark on board, too. So how long ago did you start this process, and what was the difficulty, maybe say, in bringing it all together?
Well, first of all, thanks for having us, Eric. I will tell you that we started in 2017, but we've been working on it since that time. It all started when trauma surgeons came to the city and talked to us about how do we actually turn the spigot off on some of the things that we're seeing. We're seeing too many people come into the hospital with gunshot wounds, only to return later with more people. And we understood that. We understand the fact that oftentimes victims of crime can become perpetrators of crime, but we also understand the importance of knowing that law enforcement in and of itself cannot turn off the spigot of violence. Prevention is absolutely the thing that you want to see happen, but sometimes intervention is the only thing you have. And when you can do that, you have to do that with partners. And we found partners who were willing to actually work with us to accomplish that with University Hospital and our local legislation.
And when you talk about that legislation aspect, what was needed to address some changes there? Because there were some things that had to be done at the state level.
Absolutely. I'm going to pick on Representative Clark for just a second here. It took legislative action to do what we're trying to do here today, and that is have a collaborative response to engaging those who come into the hospital with gunshot wounds. But in order for that communication to truly occur and be consistent, there had to be something in place. There had to be meat on the table per se, that allowed us to have this relationship. And what Representative Clark did for us ensured that that would happen.
Representative Clark, it's definitely a point to bring you in here. So, was this something that you saw immediately, or you got some already understanding of this from how you work in the community and working with your community?
Had absolutely no understanding of this. I was on the campaign trail, Eric, back in 2018. Had an opportunity to speak to a group to which Deputy Director Graves belongs, and he put me on the spot and asked me a pointed question.
Okay.
And that question was, why doesn't Alabama have mandatory reporting? Well, immediately I thought about the fact that Alabama does require that that we report child abuse, for example, and elder abuse, but that was not the type of mandatory reporting that he was talking about. So he had to explain that he was talking about the mandatory reporting of gunshot wounds, for example, by hospitals and medical facilities.
Does it surprise you that you didn't have it?
It did. And not only did it surprise me, but it surprised members of the Alabama House Public Safety and Homeland Security Committee. That committee vetted the bill once I introduced it in the state legislature. And my strategy for helping to get the bill passed was to get the members of that committee, 12 to 15 members of that committee, most of them with law enforcement backgrounds, to sign on as co-sponsors of the bill. And they did in fact do that. But as I approached each and every one of them, some said, I thought we already had this, that this was already law. And so I think it is being done in some places, but we did need to give it teeth, as Deputy Director Graves said. We needed to make it mandatory through state legislation that hospitals and medical facilities report gunshot wounds.
So it sounds like you didn't have any difficulty in making this happen in Montgomery, where for some things it seemed to take pulling legs and arms and everything else.
Indeed, indeed. This was one of the easier lifts because, as I stated, some of law enforcement thought that this was already the law. And I think at the time that the bill was introduced during the 2019 session, Alabama was one of only about, it was less than, it was 3, I was going to say less than 5, but it was only one of 3 states that did not have such legislation. And so this was working throughout the nation, and no reason why we shouldn't have it, except that it took all these years for Deputy Director Graves to come and say, pull my coattail and say, let's get this done. And I was too happy to oblige.
Dr. Williams-Hogue, of course, you've had some involvement in programs that reached out to the community in ways that deal with violence. So when you were aware of this program coming into, I guess, fruition, what did you think, and were you ready to go?
Yes. Well, at the time, I was actually a trainee. I was a resident learning to become a surgeon. And so to see, people in their respective positions being able to push forward an issue that I could see in real time the impacts as a learner, as a trainee, taking care of patients that are coming in as victims of gun violence, and seeing them be able to push something forward that would have lasting impacts, positive impacts on the patients that I was taking care of. That really changed the game for me in terms of what my future career would look like, with more of a public health focus, not just taking care of patients at the bedside, but really being outside of the hospital walls and helping to make a difference.
Did this require some major changes in the hospital organization to incorporate this into your daily procedures?
Yes, absolutely. So we had to implement processes so that when patients, victims come in, we had the infrastructure that we needed to be able to appropriately report and appropriately communicate with key people key institutions, stakeholders who are involved in the care of this life.
My goodness. So a lot had to happen to bring this all together, and one of the groups that we don't have with us today, but a very integral part, the Mobile County Health Department. How do they fit in?
Absolutely. They have a vested interest in public health, public safety.
Yes.
It is so important that we start to rethink public safety. And traditionally, we always see it as police and fire. And those are very important pieces of public safety. It's the heartbeat of public safety. But those agencies also, or those departments, need support. They need partners. They need the partners in public health, the partners in education, our NGOs, so many. The lady who lives on the corner, everyone. Okay.
NGO?
Nonprofit or NGOs and nonprofit organizations.
Using those. Make sure everybody knows.
Acronyms,
Yeah,
right.
I understand.
Yeah,
No problem.
Yeah. It's your nonprofit organization, but to tell you that everyone plays a vested interest in public safety, and trying to get people to see their part. We're not asking everyone to run to the danger,
Right.
but we're asking people to report the danger and to support those who respond to the dangers, and making sure that we also address the need to support people who are in crisis, who may have come into conflict, oftentimes not due to anything that they've done, but just being someone who was in the wrong place at the wrong time sometimes, and making sure that we put services or wrap services around those individuals who need that support.
And sometimes, of course, it can be family members or friends who knock on your door and come in and brings some violence along with them that they weren't even aware of was following them at that time. A lot of things to look out for. Some great information. We're going to talk more after the break coming up to let people know where the program is now and when do you expect for things to really be in place to touch those areas of the community. We thank you for joining us today here on Perspectives. We've got more in just a moment. Welcome back. This morning we were talking about hospital-based intervention program, in fact designed to deal with violence in our communities. Dr. Ashley Williams Hogue is here this morning, along with State Representative Adeline C. Clark, and of course with the City of Mobile Department of Public Safety Deputy Director Curtis Graves. We thank you all for being here this morning. As we were talking about the program, we've got sort of the framework and the groundwork laid out now. So what happens now?
What happens now is the City of Mobile providing the funds to University Hospital so that they can start the process of standing up the program. Thankful to Mayor Stimson for his forward thinking and knowing that we needed to do this.
He was really behind this.
He was behind this and very supportive of providing the funds needed so that we could give University Hospital funding for the first 2 years of standing up the program. So that has happened. We're finishing up transitioning those funds to them, hopefully this week.
Yes, yes.
Hopefully this week, and so that Dr. Williams Hogue can get to business.
And the health department is also a part of that
The health
financial
department
contribution?
Absolutely. They are playing an instrumental part also in providing funds to support this initiative. The intent is for us to improve collaboration. I mean, it's so important that we find ways of working together for a common cause, and that is mitigating gun violence in our community, because it's such a it's one of those things that impact more than just the individual who's impacted by the gun violence. There's a ripple effect. There's also an economic effect, and understanding how we all benefit from coming together to address those concerns and needs are important.
Before we move on to Dr. Williams, you've modeled this after other successful programs around the country, so you took a look at what else was happening.
We all have. We looked at several different programs that were new and emerging programs in different cities, some longer than others. Dr. Williams can kind of speak on one of the ones that she's looking at modeling, but there are a lot of effort and a lot of conversations took place to visualize what this needed to look like.
That also tells us that we're not alone. It's not just a problem for
Right.
Mobile.
Yes.
Dr. Williams Hogue, so now everything is in place so that you can put your program together. Tell us what the plan is.
Yes. So first is a planning and training, essentially section of time. to really make sure that when we get this off the ground, that it works, it's effective, and it's impactful, and that it's doing what it's intended to do. In part of that preparation phase, we are partnering with the HAVI, which is the Health Alliance for Violence Intervention, a national organization that has done a lot of work in this space, particularly with hospital-based violence intervention programs, but also moving forward federal legislation with the Bipartisan Safer Communities Act. They've been instrumental in that and working with officials. But we don't have to start from scratch because they have done a lot of the groundwork and have evidence-based protocols and processes that they'll help us to implement and put into place that has been replicated across the country at several different sites.
That's awesome. Tell us, what happens from the initial point where that individual has come into the hospital with a gunshot wound? What happens?
So we will have a fully staffed team that will work in concert with the medical team. And this team's whole responsibility and goal is to do a needs assessment of every patient that comes in who suffered a gunshot wound. They do a needs assessment, not just looking at the incident alone, but in addition to looking at the incident, are there others who are in danger? How can we, make sure the individual and their families are well equipped to prevent re-victimization, prevent retaliation? They will also address those needs by providing wraparound services, social services, psycho-emotional services, all the things that go into our full recovery, all of that in addition to the medical care. So logistically, what that looks like is we have credible messengers or violence intervention specialists who are trained to meet patients and families at the bedside. The first goal is to build a relationship so that they know that these credible messengers are advocates for them, advocating for everything in terms of their psychosocial well-being. In addition to the violence intervention specialists or credible messengers, we'll have a social worker who is helping to put together a safety plan for each patient while they're in the hospital, but this safety plan extends into the recovery period once they're discharged. And that means figuring out what issues there are, not just health related, but it may be employment, it may be mental health needs, it may be food insecurity. All of these things that the social capital building is essentially what we're doing. All the things that put certain people at advantage and certain people at disadvantage, we want to level the playing field by wrapping them in the services that they need and connecting them with community partners who work in that space.
Now, some people who come in will be critical versus non-life threatening.
Yes, that's right.
Is there a way you have to be prepared to deal with their particular condition?
Absolutely. So medical care always takes priority. Our whole goal is to save a life, but then to also add these services to it at the appropriate time to enhance quality of life.
It sounds like an incredible program. Now, with your Project Inspire, have you noticed a attitude that a person may have when they come in? I guess especially if they are a perpetrator versus being a victim. Is that something you have to deal with and have an understanding of that?
Yeah, well, certainly, whether we're talking about patients or whether we're talking about participants of Project Inspire or whether we're talking about the people helping to, take care of our participants and patients, we all have our history. We all have our experiences, lived experiences that really influence how we handle certain situations. There's a term, and I don't want to get too, research focused, but adverse childhood experiences. We know that things that happen to you as a kid really affect how you deal with certain situations, specifically how you deal with acute situations, things that happen out of nowhere. And so we do have to take all of that into account. But for Project Inspire specifically, we're working with kids who've had experiences that kids shouldn't have. And so there is a lot of, recreating what normal is and what normal, should be for a kid. And so we just wrap them in love, pour into them, and try to empower them in the best way that we know how to help them to meet their full potential.
Yeah. We've got a little more than a minute and a half left here. Representative Clark, what do you want to see happen with this program? What do you want to see come out of this program?
And I want to see this program grow. I already know about the successes of Dr. Williams Hogue's program, Inspire. I think I may have even met some of the students with you at some point, and it's just amazing to hear their success stories. And if they can do it, more of our youngsters can do it too. They just need some guidance. Sometimes they're lacking education and job training to get that employment that they need to get on the right course. And so I know we're just starting. I already want to see this program grow because there's such a desperate need for it, for our youth in all parts of Mobile, not just in District 97, but throughout Mobile
the whole
County.
Community.
Yes.
We have about a minute left, and what are you all in the Public Safety Office looking for?
We're looking for what our community demands and requires, and that is reduction in violent crime in our city. I think that's the most important thing, but we also want this to be a template for the entire state. I believe that Dr. Williams' passion and her knowledge of the problem allows us to have the hope and to be inspired to see this thing actually become something much better than just what it does for Mobile.
Well, we thank all three of you very much, Representative Clark, Dr. Williams Hogue, and of course, Deputy Director Curtis Graves, for coming and sharing, and hopefully the community will be ready to do what they need to do and what we all need to do to make it happen. Thanks for joining us. We'll see you next time on Perspectives.